is, which is worse, 1 soda a day or 10 sodas a day? Vincent, which is worse?
I mean, just based as a student and you as an instructor, obviously, like I would say that if what you said with pH and acid, if every time I take a sip of something acidic, something is going bad. Like let's take Coca-Cola for an example. Acid levels are then high. So I probably should consume that all at once and not all the way throughout the day.
You're a good hygienist, Vincent. You know it. You get that. And that's incredibly accurate because most people say, well, 10 sodas a day. I say it depends on how you consume it.
Yeah. Angels and demons fighting in the deep end. I turn all my weakness into something I believe in. Every scar, every doubt, that's fuel when I speak. Welcome to the battle where the broken get free. Yeah.
Alrighty. Welcome to Angels and Demons podcast. Our guest today is Dr. Miller, a seasoned dentist. He's been practicing since 1992.
Yes.
Dr. Miller, so good to have you on Angels and Demons podcast. Thank you for coming on the show. It's so exciting to have you here.
It's good to be here. And should I call you Vinny? Because I've only ever known you as Vincent for the last 30 years.
Let's do Vincent. That sounds cool.
That's what feels good to me.
Vincente.
There we go.
I like it.
Okay.
How was the flight?
I had a good flight. It was late, but your parents took good care of me.
Good.
And had a good bed to sleep in. And, of course, had plenty of conversation with your dad. You know, never an end to that.
He's kind of like me. He's a yapper. Are we yappers? Like we just endlessly talk?
It must be a Morgan thing.
I think so.
Yeah.
It's like an on button and then it's just endless talk. And then there's an off button when we just pass out.
I think the fact is now you found your calling. Because
I can just yap
a chance
endlessly.
to talk and nobody out there can say anything back.
Well, unless I say the wrong thing.
Well,
then
that's
I'm
true.
Then I'm in trouble.
You got to be held accountable.
Yeah.
Yeah.
That is true. That is very true. Well, let's dive right in.
Ready.
You're a seasoned dentist. You've been practicing, like I said, since 1992. And Dr. Miller, I've been practicing as a hygienist for 15 years. What is going on in dentistry?
Dentistry, I think, is going through somewhat of the same change that medicine went through probably 30 years ago. And that is, you remember, you're not old enough to remember, perhaps.
Oh, thank
but
you.
It used to be that the family, you had a family doctor. That was your physician. That's who you saw. They had a little shop, or maybe they were in a room of their home or something, and that's who you went and saw. It's so hard to find private practicing physicians these days. And a lot of that's just because the expenses have gotten so great. The corporate model has come in and it's very alluring, very appealing. And I think physicians realized in order to be not have to do all of the headache, which is owning a business. I mean, anybody out there who owns a business knows that it's a lot of work. So, they partner up with these corporations and dentistry is starting to go that way. And, people say, I don't want to go to a corporate physician. I want to go to a private practicing physician. Well, good luck finding one. And so in dentistry, we're putting up a pretty strong fight simply because we know that dentistry is really a very important relationship-based model of healthcare. And so we're just kind of seeing the sun come up, I guess, on some of these problems in dentistry. So, and I'm sure we're going to get into that.
Yeah. That was one of the things I was going to ask you was first, and what is going on in dentistry is I've noticed that dentists are very frustrated when they're coming off. They start a new practice or, they start their own private practice. And I saw that the numbers are between right now, according to Google, they're between $300,000 to $750,000 in debt.
Yeah.
Does that sound right?
It is correct, but it doesn't sound right, if you know what I mean. When I went to dental school, you mentioned, me being a practicing dentist since 1992. So from 1998 to 1992, I incurred $42,000 in student loan
Stop
debt.
it. $42,000.
That's what it cost me to go to dental school.
That is wrong.
Well, and
you stole it.
No, that was the, a fair. In fact,
inflation, that was probably a lot of money.
Well, it was, but even before then, dental school was considerably less than that. And so my big question is, why does it cost 10 times as much to go to dental school 35 years later than it did back then? And the answer, in my opinion, the answer is it doesn't. It doesn't cost that much more. But the thing is, if you want to be a dentist, guess where you have to go to become a dentist? Dental school, yeah. And so they're like, hey, man, this is a great place to make money. And these kids, and that's what they are, these kids, they got to pay it. And if they don't pay it, they don't become what they want to become. So we can charge pretty much whatever we want.
Wow.
And so, and again, I think that's some of what's going on. But there's other kind of parts to that. And maybe we'll get into it.
Who's running the political system behind this? Like, I mean, who decides how this is all done?
I mean, it's the universities.
Okay.
Yeah. I mean, we talk about, student loan forgiveness, student loan debt, all that kind of stuff. Does it really cost as much as you're being charged to educate people? And I don't want to open a can of worms here, but I'm just saying.
Please do.
But I'm just saying when it comes to dental school, it is a lucrative prospect.
On that end of it, educating dentists is a lucrative prospect.
Well, it has become now, I believe.
Yes.
Yeah. And then, what happens, and here's the ripple effect of that. Then what happens is after you graduate from dental school and you're $400,000 in debt, you can't just go hang a shingle and say, hey, I'm going to become a dentist and build a little office and wait for people to show up. You are in a tremendous bind, a tremendous amount of debt. And
can't imagine the anxiety from that.
Well, it settles in quick. I can tell you that. You're going to school and you're learning and you're enjoying and you're creating your passion for this future of yours. And you may even have, been starting a family because, I mean, we're talking people who are in their, early to mid 20s, non-traditional students that may already have families. So to just immediately before you even start any job to know that you are $500,000 in debt, that's scary. And so
that is scary.
So that's where then this corporate comes in. And I call them the vultures. They're the ones flying around over the top. They're flying around over the top of the dental school, and they're waiting for these little poor dental students.
But it's like a Lion King, the hyenas.
Yeah, they're just waiting.
We see you.
Yes, and they step out of the school and they get proposed to by these corporations, which I can't blame them. I mean, you've got to get a job, you've got to get a paycheck, and because you got bills to pay.
Do you mind if I bring to light just a little of the expense?
Well, no, go ahead. Yeah.
So from what I looked at, just the lease for a dentist is around $3,000 to $7,000 a month. The build out and renovations is $50,000 to $120,000. You're talking your equipment, your dental chairs, easily $150,000 to $300,000. Staff, payroll, insurance, software, marketing, and then you said $500,000, $600,000, $700,000 in debt. The suicide rate, we've always been at the top. When I read those numbers and I checked them in 3 different sources, they were all accurate. I am telling you, how does someone get up out of bed? Like if you knew you owed $1 million and then you have to go into work.
Well,
I didn't mean to backtrack there, but I was just the amount of debt.
There's a lot that you bring up there. And first of all, most people that go to dental school are going to be pretty kind of cream of the crop type students. These are students who have excelled at school. They've done well. They've done extracurricular activities. They've done community involvement. They're building their resume to be accepted to dental school. And so you're dealing with people who
very intelligent.
But also driven. They're very driven. And so anybody who comes out after that, most of them are going to do their best to make something of it. I mean, they've invested this time. They know they've got money to pay back, and they're already driven. So they're going to get in. They're going to go after it. Again, going back to the corporate thing, though, and you're right about some of these numbers. Because I just recently opened a couple of years ago, opened a new practice in a new city. As you know, that where you and I met, we were from mid-Missouri, and I lived there for 55 years.
That's
folks.
Right. That's
right.
Best folks.
Yeah. A Mizzou graduate, M-I-Z.
Woo.
That's right. And so I lived in Columbia, Missouri for 55 years. I had a private practice in Columbia, Missouri for 30 years. And so as I started
a very successful practice, because everybody knew Dr. Miller. And I'm just saying, like, as a kid going there, my family going to see you, you were the guy. I mean, it was like,
thank you.
It was like, is there 100,000 people in Columbia?
Yeah, it may be 125 now, but
I would say 6 to 8% of that population knew you, and that you were a very top of the mill dentist in Columbia, Missouri, and thank you for that.
Well, of course, and I'm happy to do it because that's kind of dentistry is my passion.
I actually still have a feeling. Oh, I care that you did.
That would have been a long time ago.
It's still there, though.
Yeah.
That's how good you are. It's still there. No pain.
Yeah.
I drink.
Well, look at your smile. It's like you take care of things.
Well, you told me to. You told me brush and floss.
Right. And you're a hygienist now, so you really take care of things.
Yes, I should.
Well, okay. We'll talk about that later. But anyway, hey, going back to the corporate thing, and yes. There's one more entity here that we haven't talked about yet. We talked about the schools and how much that they're charging.
Broke after school.
And we've talked about corporate and how they're just waiting for young students to come out and really, in my opinion, put them in situations they're probably just not quite ready for yet. But then we've got the third entity, and that is insurance.
Uh-oh.
Okay. Now, insurance, it's important to have insurance.
Why has that become like a dirty word now?
Well,
it used to be like a lifesaver. Like, here's your lifesaver,
right. Well, and it used to be the guy who, did your insurance was your neighbor, and you knew him, and you're like, hey, Bill, or hey, Sally, I've got this thing going on. They're like, yeah, we'll get you taken care of. And it was just all very agreeable. It has become this just profit monster. And when you want to know who has the money, think about who has their name on football stadiums.
There you go.
Who has the halftime show 60-second commercial?
Aetna, Humana, Delta Dental.
Yeah, well, and
Cigna.
Delta Dental, I of course want to be careful with what I say, but that's a different entity altogether because of its nonprofit status.
You're right. And I forgot about that.
But again, here's what's happening is insurance is doing its best to squeeze down the costs of dentistry, which the consumer might think, well, that's good. We want lower cost. But at what price? You can't have low cost and high quality existing together hardly ever. And so when you're driving down costs or keeping costs stagnant, you're not really allowing for improved services or even up-to-date services.
It's almost become like a coupon.
There's no capital people can invest back into their business. And any good business owner is going to invest back in their business.
Yes,
and what I saw, and I have some experience with corporate dentistry. I actually worked for a corporate dental chain for a year while I put my current practice together in Texas. And so I know that they do things very differently than I do them as a private practice owner.
Does that bother you?
It's a business model. Dentistry is a niche market.
Yes,
okay?
Sir.
And so what that means is, and I use this example where I live in Texas because people know these businesses I'm talking about. And that is, I tell people, if you want a really good meal in a nice environment, great service, you don't go to Whataburger. Okay?
That's a really good analogy.
You don't go there. But if you want a cheap burger, fast, and you just want to get it in your mouth and move on, then you don't go to, around us, it's Perry Steakhouse. It's fantastic. Chef's kiss. But anyway, so dentistry has niche marketing as well. There are some people that want to go to the dentist and just get their problem taken care of. Maybe get a tooth pulled or whatever the case may be, and they want it cheap, they want it fast, and they don't want the relationship. They don't want the connection. And then there are people who really want to know who's helping them, to make sure they trust who's helping them.
That's a key word, trust, you just said.
It's all about trust. It's literally all about trust. And I think that's one of the things, unfortunately, that I noticed is lacking in the corporate model is the long-lasting relationship that builds that trust. Because you can trust somebody right away because you're a nice person, but you don't truly trust them until you've had a relationship and know more about them and know if their interests and your interests align with each other.
That's a good point.
Yeah. So, and in corporate dentistry, a lot of times it'd be different dentists moving in and out, or maybe a group of dentists working together. And so one person may see you for this, another person may see you for that. It's a different model. Now, some people don't mind that. In my practice, what I say is my patient, describe my patient? I would describe my patient as the discerning patient. This is someone who says, hey, I want to go somewhere where I know the people, I trust them. The moment you walk in the door, and our Google reviews say this is what they talk about all the time. The minute you walk in the door, these people are so nice and so helpful and so friendly, and they answer questions and they take time, and you can't have that in a busy, low reimbursing corporate model. I mean, Walmart is known for having cheap stuff and cranking it out, but do they really have the service there? I think most people would agree it's not the same.
100%. And now that we're in the corporate side of dentistry, I think that you made a really good analogy with the restaurant and the hamburger there. It is so true. I just want to dive a little bit deeper into some questions like there's a growing concern that when a private practice transitions to a corporate or a DSO model, treatment plans can significantly sometimes increase. Yeah. In your experience, is that perception fair?
It's very fair.
Okay.
Yeah. When I worked for this corporate, the dentist that was there before me had a very different treatment planning and diagnosing routine. It was everything needed to be fixed right now. And the people would leave with lists before I got there that were thousands of dollars and pages long. And
like a hockey game, like,
yeah, well, that's
lights flashing.
I think we're consumers, right? I mean, we get it. That is overwhelming. You go in, you're like, okay, I need to get my teeth checked and cleaned, or maybe I've got this little thing that's bothering me. And you leave here with this outrageous recommended treatment plan. And maybe you haven't really even had a chance to sit down knee to knee, eye to eye, like we're doing here, and get to know the person who's about to do this for you.
I wonder if that's why Community First and the loan companies are right next to the dental offices. I'm just joking.
No, but you're not right. You're not wrong. I mean, you're not wrong. You're not wrong. Because we do offer financing in our practice. People want it. What I've found is that when somebody tells me, hey, let me think about it. And I get it. I'm a consumer, like I said. And I said, that's totally fine. I want you to have a chance to think about this. If you have any further questions, let me know. But may I just ask, when patients tell me that they need to think about it, there's usually one of three things they're kind of thinking about. Number one is, do I really need it? Number two is it going to hurt? And number three is, can I afford it? I say, really of those three things, which one is on your mind the most? And, most people just say, well, it's a lot of money. And I say, so what you're saying is you trust me, and I appreciate that. I will never betray that. That you know that you need it, that we're going to take good care of you, but we just got to find a way to fit it in your budget. Is that right? And most people say, yeah. So we do offer financing in our practice so that people can get what they need now. It's like buying a car. Get what you need now and pay it over time because you need it now.
Dr. Miller, if I may say, and I don't mean to be rude when saying this, but dentistry is we just went over the expense that a student has, and we didn't even go over the equipment of electric drills and all that kind of stuff, and the cost of just the materials. And so a lot of times when you present, like these insurance companies, they're almost like coupons. A lot of patients don't even know when they bring in an insurance what it even is or what it covers.
You're absolutely right.
And they feel like no matter what treatment plan they receive, no matter if it's $5 or if it's, $5,000, that somehow you are a criminal. And I just feel like that to me has left me defeated in dentistry because there's such a need. Some people walk in with such a need. And so when they come in with such a need, and you're talking about trust, what do you do? What do you do? How do you approach them if there is an expensive treatment plan that's needed?
Well, the first thing you do is you sit down and you get to know your patient. I have an acquaintance form in my practice, and it has about 25 questions on it. It really just goes over your dental history, and then more importantly, where you want to go from here. And I tell everybody all the time, my job is to help you get what you want. I'm really not that much different than somebody who might be selling widgets. I mean, if somebody comes in and says, hey, I need to buy a widget, the first thing I'm going to say is, what kind of widget are you looking for? What is your goal here? What do you hope to do with this? And by knowing their story and where they want to go, then I can say, yeah, I can partner with you on that. I can get on board. We can do this together, and we can make things the way you want them to be. But corporate dentistry doesn't really afford that amount of time. When you've got 30 minutes to clean teeth,
or less.
Yeah, and you're doing assisted hygiene, and you're doing, you're trying to do a really good job, and some people come in and they got a little more cleaning to do, and some people got a lot more cleaning to do, and you're trying to squeeze it all in time. It's not a one size fits all on cleaning teeth, is it?
No, not at all.
But the schedule's a one size fits all.
That is correct.
Yeah. So that's part of the issue, is that if there's not that amount of time to sit down and build the relationship first, then you're just cranking people through. You're just, at that point, dentistry becomes a commodity.
I just felt when I saw you so relaxed. I don't know how to put it, but I just felt at peace. It was my sanctuary. And I honestly mean that. I don't know if there's something like spiritual blessing that you have above you, but I just felt like when I was in the chair, like God was there. Like you were, I hurt. You're my dentist. I'm in pain. And you would always help me. And everyone that I knew, you would do the same. And that culture just seems to be diminishing.
There's a lot to unpack there. First of all, thank you for saying that. My goal is to always make sure that every patient that I help has that sense of trust, and because it's vulnerable to lay back in the chair
with your mouth wide
open, and you don't know what's going on in there, and you're relying on the person that's looking to tell you the truth. How hard is that? I mean, just be honest and tell people what's going on, but don't just tell them what's going on. Find out about them first, so whatever you're talking about or recommending is aligning with their goals. Because I could come in and say, oh, you need this, but it's like, again, like going to the car dealer and say, hey, I want a car, and they're like, that's yours. And you're like, well, but wait a minute. I don't, you haven't even asked me what I really want.
That's a really good point.
So, yeah, I think, that's just the difference a lot of times. And there are good guys and bad guys. There are good people and bad people in both corporate and private practice dentistry.
Every profession.
In every profession. That's just the way it is. And if you get that kind of feeling like this is a good fit, stay with it. If you get that feeling like, I don't know so much, get a second opinion. Go find that fit. We don't all just marry our first girlfriend, right?
That's a good analogy, yeah.
So
on Tinder, hey, how are you? Yeah. Okay, let's go to the courthouse.
No, that's just that. So, yeah, and let's go back for a second, because that practice that you saw me at in Missouri, that I had for 30 years.
Gorgeous office.
Well, yeah, thanks. And I want it to be a comfortable setting where people come in. I'm not all about flashy. I'm about efficiency, but also comfort. It needs to feel right. And again, dentistry is a niche market. Some people might come in and they're like, oh, this is too fancy. There's a lot fancier practices out there. Maybe you've seen some of them.
I never felt that feeling. I felt like it smelled really good in there. Everyone from the moment you walked in there, you felt welcomed.
Well, and that's, you're pinging on the key right there. Culture. I mean, my practice is first and foremost culture-based.
That smile from your front desk. I mean, that is just so
Well, and you surround yourself with good people. You know, that there's a saying that birds of a feather flock together, but birds of the flock are of the same feather. So that means, you know, once you're around each other, you start to just get this energy off each other. And if there's a weak link, you know, sorry, you are the weakest link, and you just got to go. We got to get a strong link in there.
You were so good at that.
Well,
everyone around you was just contagious of joy.
I mean, or it's not a fit.
Yes.
And again, we all have to decide what fits and what doesn't fit. And there's times where I run into people, and you know, we start talking about that I'm a dentist, and they go, and they're local as well, and they go, oh, I've already got a dentist. And I say, well, are you happy? And they're like, oh, I love my dentist. I was like, perfect. That's what I want for everybody. I want everybody to find a dentist that they truly love, appreciate, and trust. And because it's, I mean, you know, it's something that a dentist is somebody that you'll see potentially for years and years and years and years and years. At least that's how I think it should be. And that's why it can feel really uncomfortable. Some people go in places where it's a different person every time they go in. Like they're
not a chance to build a relationship.
There's no chance.
Yes.
And so that's when I say that it becomes a commodity. It is a crown. You're going to get a crown. You're not going to have Dr. Miller help you out. You're going to get a crown. And that's where you get this list of, here's your grocery list. Here's your shopping list. You need a crown and a crown and a filling and a filling and a root canal and extraction. And I mean, it's just items on a list. Whereas when I sit down and go over it with my patients, now it becomes this vision of what the future holds for them and what it can look like.
You literally created family dentistry. You made people feel like they were in family, and you never did anything that you wouldn't do to your own mom and dad. And you felt that from the moment you walked in. Everything was so beautiful and said. I think that you set a very high standard. I don't know if anyone's going to be able to be Dr. Miller.
Well, and you know, I think some people would say, "Gee, I hope not."
I don't know.
Yeah, but
it's
you
a special place.
Yeah, well, thanks. I mean, you're too kind, but
I'm just speaking the reality of the experience.
There'll never be another Vincent. You know, this is the way life goes. We're all unique. We all have. And if I can just go a little deeper, you talked about, you know, when we met, and you said, you know, you didn't know if it was like there was a spiritual thing over me or whatever. Well, God's everywhere. He's with us all the time. And there is a spiritual thing in everything. And so, and that's one of my goals is when people come in, I want them to feel that more than just a physical improvement, but I want them to have that emotional and even spiritual connection that, you know, hey, this is somebody I like. This is somebody I trust. And, you know, that's how I think how we function best as humans when we're in that level of a relationship.
How long do you think it takes for you and when you had your practice in Columbia to build that trust? Like, what would you say is the estimated time frame? What would you say, like 2 years, 3 years, when you really have cemented in that deep trust with your patient?
Well, you know, we're talking individuals here. You're asking about my practice, but
it's a very broad question.
So it is, but again, I don't look at it as my practice. I look at it as the people that I'm helping. I mean, I have a practice. That is the physical facility. And then I have what I do for people. And that's where the trust comes in. And so along those lines, everybody gives trust at a different time, at a different level. People have backgrounds. You have a background. I have a background. And their background is what drives their belief system and their value system and their trust system too. And so some people, it's very easy to gain their trust because they're trusting. My practice really grows mostly by word of mouth.
It's organic.
And yeah, it's organic, word of mouth. And so people are coming to see me that have heard good things about us already. So that is
that
the
make
first.
You feel good?
Well, of course it does. I mean,
yeah, I came here today because Mrs. Jones just came in and raved about you for 30 minutes in the grocery parking lot and said, you know what? Life is not going to be the same unless you go see Dr. Miller.
Well,
and you've heard that. You've heard that. I know you have.
I mean, certainly we do have a really strong following. We've got a good reputation. And those things are very important to me. I always try to kind of treat my life as like, what would people say about me at my funeral? I mean, not that I'm trying to gain their approval, but I feel like if I've gained their approval, then that means that I've done something good for them, or I've helped them in some way, or I've built this connection that, supersedes life itself, I guess you'd say, because they're talking about me even after I'm gone. So, but I want to get back to something we were talking about, and this is a kind of a real switch back, but that's the cost. The cost of operating a dental practice. Okay, because if somebody comes in and their crown is $1,200, let's say, and they may think, "Wow, that's a lot of money." Okay, we got to break that down, and I do help my patients break this down. First of all, you're investing in yourself. If you're going to invest in anything ever, invest in yourself. Invest in your education. Invest in your health. Invest in your emotional.
Invest in your dental care.
Invest in your dental care. Yeah, and that's certainly dental care is a big part of your health.
You'll buy an $8 Starbucks at a blink of an eye and not even think about it. But if you have to pay for your teeth, it's like, oh my God, what's going on here?
Add all those Starbucks up that you've purchased over the past 365 days, and you're like, I could have paid for that.
Sometimes I wonder if it's just not an elaborate way to spend money. Like, it's not a flashy way. Like, oh, look at my crown I got back here. Where it's a Porsche, it's like, hey, look at that 911.
Oh, okay. Well, and again, that's where it comes to what are your priorities?
There you go.
And for some people, their priorities are different. People have different priorities. I'm not here to judge. If somebody comes in, they're like, I don't want to do it. That's their choice. This is their mouth, their health. I'm not going to browbeat them about it to get it done. And if they come back later and they're like, you're right, it broke. I'm not going to say, well, I told you so. I'm going to say, I'm glad you came back so I can help you. And let's get you put back together.
But you're really kind, Dr. Miller.
Isn't this the way we're supposed to treat each other? Am I doing something
I've been in dentistry 15 years, and it's not the way everyone treats everyone. Not every dentist does. But I
didn't say, isn't this the way we treat each other? I said, isn't this the way we're supposed to treat each other?
That's so true.
And so, I just treat people the golden rule. I treat people the way I want to be treated as much as I can. I mean, sometimes I'll make a mistake. Sometimes I'm not perfect, but I really do want to take care of people, and I want to make sure that what I'm doing for them is, comfortable. So my mission statement, and we're all over the place with this. I do want to come back to the.
No, I think we're right on track. Okay, I have some other questions for you, but I think that it was really important for people to understand the top of what's going on in dentistry, because they're going in, and the majority, right now, 50% of dental offices, or I think it's at 57% are corporate. So we were talking about what is going on in dentistry, and I think we're doing a fabulous job of explaining what is going on in dentistry and the shift from a general practice, family practice, to where you had in Columbia, Missouri, to where now it is a chain or a corporate DSO. Well, and that was my next question for you. And maybe that will kind of bring us back if you want me to do that.
As long as your listeners don't mind, chasing us around this room while we talk, that's fine.
Yeah, no, I think it's good for the mind, a little ADD kind of all over the place. I'm kind of like a squirrel chasing a nut sometimes.
Well, I think when you're passionate about something, there's just so much you want to get out all at once that you just tangentially try to get there.
Yeah, and at the end, we'll sum it up and it will be beautiful.
Perfect.
So, periodontal disease is often silent, yet we now understand it's linked to systemic health like heart disease, diabetes, and even brain health. Why is still such a misunderstood among patients? Is it just because it's asymptomatic?
I think that has a big thing to do with it. I think a lot of people are motivated to go to the dentist when they have a problem. I always say there's two ways to take care of your teeth: before they hurt or break, or after they hurt or break. And I ask my patients, which one do you want to do? And if they say, well, I don't want anything to hurt or break, I say, well, let's look at this from a proactive standpoint then. If someone comes in to me and something already has broken or hurt, that's what motivated them to come in. So there's a very different motivating factor between the two. One is to stay ahead of the game, and the other one is try to catch back up again. And so with gum disease, because it is silent, I mean, it really, there's very few physical symptoms with it. There may be signs, like your gums may bleed, or you may have a bad odor in your mouth or bad taste in your mouth. You may start to notice a tooth's getting a little bit loose or something like that, but you're not going to really have pain with that. And so when you go into the dentist and it's been 10 years and they're like, hey, we've got quite a bit going on here. How long have you had this infection? Most people are like, I don't know I have an infection. You don't feel it. If you had an infection in your throat, you would go to the physician because 100%. You feel it. You swallow and you're like, oh, razor blades. But gum disease, as you know, is not like that. So then you've got in dentistry, we have this hurdle to overcome. And that is somebody comes in, they're not really having any problems, and you have to tell them, this is a big, big situation. And fortunately, these days, we do understand that link between oral and systemic. And the mouth-body link is really important. If somebody, you can have somebody who's working out all the time, they're eating right and all that, but if they're not taking care of their mouth, they're dying on the inside. They're being poisoned slowly by their own body.
The foundation's literally getting destroyed.
Yeah. And, then the downside to that is if people do lose teeth, then, as humans, we're pretty adaptable. We can work around things if we have to. And so when people lose teeth and they're still trying to eat with what little teeth they have left, their nutrition's not as good. Their quality of life, I would say, is probably not as good. So one thing I try to encourage my patients to think about is that, 30, 40 years from now, what do you want to be able to still continue to function like you do today? Like if I could tell you 40 years from now, you're going to be able to go run around with little Luca and be, have all this energy. And you're going to say, well, I've seen my dad. He doesn't. Now your dad's very energetic, but older people don't seem to have the energy that I do. Well, but the thing you can do and should be able to do throughout your life is eat. It can be enjoyable. It can be nutritional. It can be comfortable. And if you let too many teeth go, and if this gum disease things take over, the number one reason that people lose their teeth, and that's not cavities, it's gum disease.
And I saw a stat in retirement communities that those that do not have teeth due to gum disease, they pass away much more quicker because they do not have the nutritional aspect of being able to chew their food. Is that true?
Well, I mean, it makes sense to me. I don't know that specific study, but I'm sure there are plenty of studies out there that have been done to figure that out. But part of the issue, though, is that bacteria that has slowly been eroding at you on the inside, eating away at you on the inside, does that have something to do with your early death, maybe? So,
such as heart disease or stuff like that.
Think about what they call the stuff that lines your arteries when they're clogging up. It's called plaque, arterial plaque.
Good point.
Think about what they're calling it for people with Alzheimer's and dementia. The brain, the glymphoid system, not the glymphatic system, not the lymphatic system.
Now that's totally.
So this is a whole thing about and this is where it all comes around to sleep dentistry, to sleep medicine, to sleep health. So there's a lot of things going on. If you want to be your healthiest, you got to look at a number of different things. And so, but again, that bacteria can affect many body systems. And if it's in there and you don't know it's in there,
that's very interesting.
Yeah, then you can be in trouble. But anyway, so you were going to talk more.
Yeah. So, going from, years ago, dentistry was more like reactive, if it hurts, fix it, like you said. Today it's preventive and it's comprehensive. Do you think that patients have fully adapted to that shift? And I think you kind of touched on that to where you're like, I personally, I don't want to wait for something to break. I want to go in and do my oil changes. And if they say, hey, your filter needs to be replaced or your bearings or this and that, I'm kind of like my mom, so to speak, where I'm like, okay, this could be going out soon. There's a crack here. Your window seal isn't sealed anymore. There's water getting underneath it. We should probably seal that so that the wood doesn't rot. You know, I'm the kind of guy that's like, okay, let's do that so I'm not dealing with a problem. Some people are like, well, let's wait till there's a problem. And that brought me to the question is, can you explain how quickly decay can progress once it breaks through the enamel in the dentin, and why watching a tooth can sometimes lead to a bigger problem?
And this is a great question, but it is a very individualized question because cavities are a cause and effect kind of thing. Okay? Cavities are the effect, but there's a cause there. Cavities don't just happen. Cavities happen because of some cause. And the cause could be as simple as not brushing and flossing properly. So the bacteria has a place to hide, and it hides there long enough. Bacteria wants to destroy one of two things, either your teeth or your gums. That's what bacteria does. And incredible.
And right as we're talking, I never thought our teeth are constantly in a wet environment. That's kind of weird. I don't know why I never thought of that.
It's a good thing because, gosh, now you're opening up another chapter.
I'm sorry, that's my ADD brain. I was just like, why our teeth are constantly in water, like the ocean, like a rock in the water.
And that's, we're talking now about xerostomia or dry mouth issues, which is huge. So our mouth is an environment in and of itself. Believe it or not, we actually have good bacteria in our mouth. So you don't want to destroy that good bacteria, but you also, at the same time, want to try to destroy the bad bacteria. So there's ways to do it.
How do you destroy the good bacteria?
Well, I mean, if you're using like a mouth rinse that is pretty strong and you're using it over and over and over again.
Oh, like the burn. I remember that commercial. The burn, the Listerine, the gold one. My grandpa had that one. He was like, when he breathed, it was like, whoa.
Yeah, I know back in the old days, if it didn't taste bad, it wouldn't be good for you.
Yes.
And I'm like, if it burns your mouth, I'm not sure that's good for you. Certainly there are other ways to take care of your mouth that are less harsh. But the mouth is all about balance. It's all about balance. And one of the key balance factors in the mouth, in our body, in your swimming pool is pH.
That's a good analogy.
The balance has to be correct. And if the balance is out of whack, then
what should the balance be in our mouth?
Well, I mean, it should be more basic than acidic.
Okay.
So the saliva is super important for helping to buffer acids. So our saliva is slightly basic. It helps to wash our mouth out, to keep the internal mouth moist, to help, of course, start food mastication and digestion.
So you're saying when it dries out, it doesn't have the ability, the saliva doesn't have the ability to be basic.
There's no saliva there. Your mouth is not getting, things are drying out so that it's not this constant flushing and fluid that's moving through there to move things out. It's like your circulatory system. If your blood's not constantly moving, you're dead. If your saliva is not constantly moving through your mouth can end up dead.
That's very interesting because we had a patient the other day that had no cavities and then they were put on like 7 medications and then they came back and they had like a balloon amount and it was like clear as day. And I'm like, as you're talking, I'm thinking about it. I'm wondering because the first thing she said is my tongue is stuck to my mouth.
Yeah.
So there's no salivary flow, keeping that pH balance.
That's right. It's been diminished. Well, and the other important thing that saliva does, besides the pH balance and, just keeping the environment kind of flushed, is the supply of minerals to remineralize our teeth. I talked about balance. Decay is a balance between demineralization and remineralization. This is happening just like our bones. Our bones are constantly remodeling. Our teeth are constantly remodeling. We eat and drink acidic things. Our teeth get a little bit damaged from that acid, and then our saliva comes along and recharges them. And if you don't have saliva, in a good enough quantity or a good enough consistency, quality, then, excuse me, then your mouth can suffer. So back to the question about cavities and how quickly does a cavity progress. I've seen cavities where I've said, hey, let's keep an eye on that. You haven't had a big history of cavities. This one, I see it between your teeth. I see it here on the x-ray. We're going to check it again in a year or so or whatever, however long we decide to take x-rays on that patient based on their specific needs. And because if you're going somewhere and every 6 months, we need x-rays, we need x-rays, we need x-rays. I'm like, time out. Why? Now, if they have an active disease process, okay, that's something. But if you're just coming in, you've got a healthy mouth and you're going to this place and the first thing they do is start zapping you with x-rays, that's overkill. You don't need all that. My opinion, and it's backed up by the ADA, the American Dental Association, saying, hey, let's scale back.
You're 100% right. Some can be taken every
x-rays.
18 months.
Right. Or, so I have kind of a rule in my office that this period of time, I need these type of x-rays, and this period of time, I need these type. In between, if things are looking okay and the patient's not reporting a problem, and we have the baseline of their x-rays before, but if I see a small problem, I might say, hey, if you can tell me you'll come back in 6 months, we'll look at it again. Or if it's on an x-ray, then I say, let's check it again, in a year. So if somebody's drinking, so here's the thing is, I'm going to ask you the same question I ask a lot of patients, and that is, which is worse, 1 soda a day or 10 sodas a day? Vincent, which is worse?
I mean, just based as a student and you as an instructor, obviously, like I would say that if what you said with pH and acid, if every time I take a sip of something acidic, something is going bad, like let's take Coca-Cola for an example, acid levels are then high. So I probably should consume that all at once and not all the way throughout the day.
You're a good hygienist, Vincent. You know it. You get that. And that's incredibly accurate because most people say, well, 10 sodas a day. I say it depends on how you consume it. Because
sippers,
sip all day, get decay. I mean, that is.
I've never heard that one. I'm stealing it.
The Missouri Dental Association had that one or something like that. But, the thing is.
Because your acid levels are
right
up here.
It's like going in the sun. I mean, which is worse, getting a sunburn or getting a sun tan? And, I think getting a sunburn every day is a problem. Having your skin slightly tanned, hopefully that's less of a problem, but it's all about exposure frequency, duration, contact time, all that kind of stuff. So
I think it's safe to say the baby oil back in the 70s, that was a no, right?
Yeah.
Okay. I didn't print the fact off on that, but I didn't want to misspeak, but rubbing baby oil just to back you up on that one.
Yep. So, but we are and again, just to kind of tie this all together, my patients who come in, one of my questions on my acquaintance forum is, do you use tobacco products? And
Zen, everyone's doing Zen. Do you notice that? I don't even know what Zen is.
Well, we can probably get to that in just a second, but I want to talk about the smoking issue, and maybe we should talk about the Zen because I lost that one. I lost where I was going with that.
I'm so sorry because everyone's Zenning it. I didn't even know what it was.
Well, and again, it's contact time, frequency, duration, all that kind of stuff. So when I have patients that come in and use tobacco products, my speech to them is, I recommend you don't do that. That's my speech because it's not like they haven't heard it before. What I was going to say earlier, if you don't know that tobacco products are harmful to your health, you haven't even looked at the label of the package that you're using.
And this is why Dr. Miller is so amazing because I'm going to tell you, you are one of the few dentists that actually said that. There are so many dentists that people smoke and do not even say anything about it.
Well, I'm not going to tell them anything they don't know. So if I just say, I recommend you don't do that, that's my speech. I'm not going to go into it. I'm not going to,
point the finger and start really pounding it.
What good is that going to do? But the thing about soda is that, and really there's a lot of things. It's not just soda. There's other, carbonated, softened beverages. There's other sweetened beverages that can be a problem. But
ice,
the thing
just
about
that water ice. The first ingredient was acid, and I didn't know that until the other day. I thought I was drinking water and everything was good.
But you saw it in the ingredients. Where was the warning label that this can cause destruction to your tooth enamel?
Dr. Miller, I'm just gonna be honest. I didn't see any.
There wasn't one. So why is it that we have warning labels on tobacco products, which we know can be harmful, but we don't have warning labels on some of these beverages that can be harmful to your teeth? So, I mean, there must be a lot of money, a lot of power floating around keeping those warning labels off, because it was up to me, there would be a warning. So I've got a grassroots campaign in my practice.
That's very interesting.
Where I ask this question, 1 soda a day versus 10 sodas a day. And I tell them, I ask them, do they know much about pH? And some people do and some people don't. I say, well, let me explain to you. pH, water is at 7. That's the pH for water. Battery acid, stomach acid, that's at 1. That's the number they give for the acidity level. And anything above that is the basic stuff that's going to, help control the bacteria. But I asked them, Coke and Pepsi, and I could use any other. I'm not trying to call out these products.
Well, the number one drinkable,
these are ones we know about.
Products.
But what do you think the pH is of Coke and Pepsi? We got 7 for water. That's neutral. That's good for you. We've got battery acid. Nobody's drinking battery acid.
That I know of. I hope not.
Or are they? So let's talk about pH. What's the pH of Coke and Pepsi? Is it closer up here to 7? Is it closer down here to 1? Give me a number. You think it's 2, 3, 4, 5? What is it?
4.
2.4. So it's much closer to battery acid. Much closer to battery acid than to water. It's fizzy. I love it. Tastes good.
I drink it all the time.
Careful.
I'm scared now.
Careful. But I mean, the acidity, so you're creating an acidic environment in your whole body sometimes. So just, it's so easy to get a soda. They're cheap. I do these mission trips in Mexico, and I go down there. And when I first got there, I was like, well, there's a lot of soda around here, knowing that you're buying something to drink. You don't drink the water that's out of the tap. You buy something to drink. And soda was actually cheaper than water.
Wow. So,
I mean, if you're on a budget and you got the sweet tasting stuff,
you're going to buy soda.
That's what you buy. And so problem. So, but some people will say, keep this in mind. Some people say, but I drink diet soda. But it's not the sugar, folks. It's the acid.
That's very interesting. So, it's not the sugar, it's the acid.
The pH level of diet sodas is pretty close. It's a little higher, but very close to what, sugared sodas are.
That's fascinating.
So, and then, there's a whole, too much candy, causes problems, of course. And even not just candy, when parents bring their kids in, I do quiz them tell me about their eating habits. Tell me about their snacking habits. And they go, oh, yeah, they snack, but, it's just like the crackers and like Cheerios, have a little bag with them. It's like, so they're grazing on these snacks all day. You realize those are refined
sugar
carbohydrates. They're sugar, basically. When you break down a Cheerio, you break it down into sugar. And so when they're eating those and they're getting kind of stuck in the chewing surface and stuck between the teeth, now you've got the bacteria is like, thanks. And it goes to town.
It just amplifies that decay. It
amplifies it. And so kids come in and they've got problems. And they're like, well, they don't eat candy. I say, yeah, but they snack so much that it's
like eating candy.
It's like eating candy. Yeah, it is. So, there's parents a lot of times don't know this stuff. And so one of the things I love most about being, a private dentist and having the relationships with my patients is teaching them. Like, I think you can tell by me talking, I love mentoring. I love telling people.
I love that about you.
Let me help you learn more about this. And some people want to hear it and some people don't. And that's fine.
And that helps build that relationship and trust that we were going back to talking about. By you taking that time and just sharing that story, it makes me feel comfortable. It makes you feel like you care to download a little bit of science in me so that my understanding is what my habits are and what I'm doing is what based upon what you're going to need to be doing. If I am not abiding by the things that you're telling me with Coke and with candy and with Cheerios and all the kind of things, the foods that are causing decay, and then I'm going in and being like, Dr. Miller, why are you handing me a high, treatment plan?
Yeah. Well, and again, the whole thing is, what does the patient want to do? What is their goal? And so one of the questions I have on my acquaintance forum is, do you want your teeth to last a lifetime? And so do you want your teeth to last a lifetime?
Yes, sir.
Is that a silly question?
No.
It's not a silly question because not everybody realizes that's possible. Maybe they come from a background of their parents or older family members all had lost teeth or lost all their teeth and were in dentures, and they think that's just the way it is in my family. That's genetic. That's the way it goes. That's not true. And so I want to help people understand that teeth can and should last a lifetime. So when they've got a tooth that's in bad shape and I'm like, hey, I can do this to fix it up for you. And they're like, just pull it. Well, I go back to their acquaintance forum and I say, hey, when we first got together, you said you wanted to keep your teeth. Tell me what's changed.
That's very interesting.
Because it sometimes it takes us, we're in the moment. We've got car trouble. We've got, got to pay our utility bill.
Life's coming at us from all sides.
And now we've got a tooth that needs to be fixed. And I just say, let's think about this long term. So, all these diseases we're talking about, cavities, gum disease, these are all really kind of slow diseases. It's like a cancer, right?
Until it gets through the enamel layer and then it kind of balloons. And that's why I was saying, is it better to be when something is headed that direction, is it better to do something?
Well, what in the mouth, I can talk to you about this, and this is the same thing in life. What do little problems turn into if you don't do something about them?
Bigger.
So, the best time to fix a cavity is when you first find it. Because somebody might ask me, well, how long do I have before I really need to fix it? I'm like, now is when it really needs to be fixed. We can fix it later and later and later, but it becomes more expensive, less predictable with outcomes. Let's be honest. Dentistry is not a perfect science. We go in there, we try to work with the body the best way we can. Body doesn't always play by our rules.
That's very true. Hey, something I really appreciate about you, Dr. Miller, is you're kind of helping us guide us through, the most important aspect of dentistry is what's going on in dentistry is the lack of relationships and trust is being disposed. So when you have a mill process where things are speeding through, on the flip side, what are red flags that a patient may be underdiagnosed or not receiving comprehensive care? Or for dental graduates entering this environment, what advice would you give them to maintain ethical integrity while navigating all these production pressures in corporate? Because we're saying, what is going on in dentistry? You have just instilled in me one of the most beautiful pictures of an individual that loves educating patients so they understand that the consequences of their daily actions can affect their daily dental needs when they come in every 6 months or whatever that time frame is to see you. But when they're working in a corporate environment that has pressures on them to be at a certain pace, how do you navigate for people in this country with corporates rising and your beautiful type of dentistry in 1992 when you had full control of based on someone had, little or less or more or this or that, you could make all those decisions. Now you walk in, and because you can't afford all the overcosts from when you went to dental school, it was $40,000. Now it's like $700,000. You don't have those abilities. And now AI has taken over. And I kind of mentioned that to you in the beginning because it's kind of like taken over the diagnosing process a little bit. What would you say to a dental student that's coming out now to guide them?
I would say prima non nostra.
And I am so lost.
Means above all, do no harm. Yeah. And that is treat people the way you want to be treated. Your reward for your hard work in dental school, for your hours of sacrifice, while your friends who you graduated college with all have moved on to their careers and they've gotten, a new car and they've got a house and they've got all that, and you're coming out drowning in debt, be true to thine own self. Be honest, be fair, treat people the way you want to be treated.
Because like you said, they're very smart students. They're going through a very difficult curriculum and they know and they take an oath to do no harm.
And use your time in corporate dentistry to build your skill set, to build your communication skills, to maybe build your efficiency, which means, get a little faster at the things you do so patient isn't sitting there so long. And, use that then as a springboard to move into your own practice. Now, owning your own practice isn't for everybody. I'm going to tell you that. I mean, it's a lot of work behind the scenes.
And you've done it twice.
Yeah, I have. And as I mentioned, I'd worked for corporate, so I'm really comparing apples and apples. I have worked for these two models of dentistry, worked in them. But if you want to have true autonomy and you want to really set your schedule so you've got the time to be with patients and to get to know them and to help them in that way, then if that's something you're desiring to do, don't let corporate dentistry taint you. Don't let it do that to you. Realize it's a means to an end. And just like for me, having that little over a year in corporate dentistry, that was what I did while I built this new practice. Physically built it, like design to
qualify for the loans that you need to, and et cetera.
Right, all that kind of stuff. And, purchasing all the equipment and remodeling the space. And when you're talking those numbers there, it's $1 million to open a dental practice.
That's what it looked like when I added everything up.
It is. I mean, and so, you've got to know where to look to find the right products, and don't skimp on products. I mean, if it's a disposable, box of tissues, okay, you can go for the off-brand. But the dental products I use, they're all well-proven name brand products.
You mean like for composite resins, resin, packing cord, implants, for putting crowns in,
all that kind of stuff. It's the good stuff,
yes.
And that doesn't come cheap.
Yes.
And so when you go in and you get your crown done for $1,200, realize a few things. Number one is you're paying for the infrastructure to be able to provide the service. Number two is
the lights, the chair, the building,
all the overhead. Number two is you're paying for the skill, experience, expertise of the person doing it. So if you're going somewhere and you're not getting good service and not getting good outcomes, you're in the wrong place. You're just in the wrong place. And
like you said, when talking to someone, if they were like, hey, I love my dentist and this and this and this, then you're like, good, stay with them.
Yeah, right. And then, another part of that expense of the crown is the dentist should be reinvesting back into the practice. If someone goes in there, if you go into a practice and you're like, this place looks a bit run down. This place looks, gosh, there's, duct tape on this.
That's a red flag.
Well, I mean, they're just not reinvesting back in their business. Now, you may be going to a place where they charge ultra low costs. Okay, well, that's where the costs are coming from. They're not able to reinvest back in the business.
That's a good point.
And so, and then the final thing that you're paying for is, everyone's wages so that they can go reinvest that money back into the community. We're a small business in a community, and corporate chains are big venture capitalist type things. Their model is, and this is what I experienced, is profit first, people second. My model is exactly the opposite. Take care of people and you'll make a living doing it. If you're honest and if you really become as much a master of your craft as possible.
That's really good insight. That's
what I encourage students. It can be discouraging. There'll be times where you're like, gosh, this is so much. And it is. And I've experienced that myself too, where I'm like, even later in my career, I'm like, man, this is a lot, but it's your love for what you do. And hopefully when you become a dentist, if you're passionate, then you will have the energy it takes to get through the hard times.
So what's going on in dentistry is there is a switch from beautiful practices that are privately owned by Dr. Miller, for an example, to where there's corporate dentistry that is starting to become the new norm. Through this process, as you navigate to take care of your dental needs, I think Dr. Miller has stated very, very specifically some red flags and some areas where maybe you can get a second opinion. Things that would maybe not hurt if you feel like you're not getting those good vibes and you're seeing the red flags he's saying, or they're not reinvesting it back into their practice, then understand that maybe there's some things that you need to relook at.
Yeah.
That's really well said.
Well, thank you. And going back to the three-headed monster, the dental school, the corporates, and the insurance. That's the three-headed monster. Do we have a minute to talk about that?
Absolutely.
Perfect.
Absolutely.
So we're going to talk about the three-headed monster. I want to go back to the insurance part. It's important to realize that dental insurance is not insurance. As you said earlier, it's a coupon. I call it a benefit. This is something that your employer has said, hey, we're going to give you this benefit so that you can go get some dentistry done. And I say some because when dental insurance started in its kind of roughly current form back in the 1970s, people would usually get about $1,000 a year to go spend on their teeth. Here we are 55 years later, and people are still getting sometimes $1,000, maybe $1,500. If you're lucky, it could be $2,000 to $2,500 a year to go spend on their mouth. Do you know what cost-adjusted inflation $1,000 in 1970 is today?
An astronomical amount.
Well, it's over $8,000. So why aren't insurance companies giving you $8,000 to go get your teeth taken care of?
Because they're supposedly, from my understanding, is many insurance companies are linked to hedge funds, and then they have to liquidate in cash, and so therefore there's a whole financial aspect there.
Because my business is a profit-based model. If I'm not profitable, I'm not in business tomorrow. But when a business is purely profit-driven and it's bottom-line driven and it's dividend-driven, then that's where things start to get in trouble. So insurance companies have raised premiums, but they've kept reimbursements low. One of the big insurance companies in my area has kept reimbursements the same since 2008.
That's hard to imagine.
Would anyone watching this go to a job that's paying 2008 wages?
No.
Or would you go look for another job?
Absolutely.
So that's why that's why I'm not a network provider. I charge everybody the same
fee for service.
Fee for service. Same cost all the way across the board for the same services. And then if they have insurance and it's something that they can use in my office, meaning their insurance allows them to choose their dentist, then we'll help them file it and we will help them. But insurance has really, people do, you said earlier, they come in, they drop down the card, they're like, hey, I've got insurance, yippee. And we're like, okay, not all insurance is the same. Let's find out more about it. But they've been sold this bill of goods that, oh, you've got insurance. They'll cover everything. It's 100%. All this kind of, they've been told these things and it's just simply not true.
It's almost like a coupon that they have very little knowledge into. Yeah, and they feel like if you do anything outside of that, then you're taking advantage of them. And I don't mean to say that lightly. I mean, they really think sometimes that their insurance policy is covering 100% of everything when they walk in the door. And they do not do the homework. And I think sometimes that puts dentists in a bad light because it's not that necessarily anyone is upcharging. It's that they're not educating themselves on what they're bringing in.
Yeah.
And so they're getting misled by the insurance companies that the dentist is upselling. And so I do want to give corporations the credit due for that because that is very, very difficult.
They're providing a niche. They're providing a service. And without corporate dentistry, I think there would be because it's so hard to
care.
There would be a real gap in care because it's so hard for any dentist to just have a private practice. Corporate is there, and it does help fill that slot. But most dentists, I think, that are really driven are going to be rather unhappy in that situation over time because they want to have an ability to, call the shots themselves and make those decisions and make real-time decisions. If there's a problem, fix it right away. You're the owner. You're the boss. Fix it.
That's a really good point. And I really, Dr. Miller, I cannot thank you enough for coming on and clarifying what's going on in dentistry today because I'm telling you, it's with dental health is clearly mental health. And you do not have proper good nutrition without your teeth in your mouth. Yeah. And this whole podcast is geared around what services and what things can people do in their lives to increase their mental health. And so you have given us so many good key ingredients to where we can plug in and do better on our dental mill so that we can make things a little bit better. Thank you so much. Yep. I really appreciate it. Is there any final words that you would give to what's going on in dentistry today for patients to look for the right practice that is for them?
Gosh, I mean, we've kind of hit on it throughout, and that is, just go with your gut. If you feel like this doesn't feel right, or they're saying things that don't, or they're not listening to me, or they did this, but it's been a problem ever since, or they're not fixing it, you're in the wrong place. It's okay to break up. It's okay to break up.
There you go. Yeah. There you go.
And search for that person that's right for you.
There you go. Thank you for listening to Angels and Demons podcast. Until next time, Dr. Miller, thank you so much for coming on.
Thanks, Vincent. But good to be here. Thank you.
Angels and demons fighting in the deep end. I turn all my weakness into something I believe in. Every scar, every doubt, that's fuel when I speak. Welcome to the battle where the broken get free. Yeah.